Good afternoon. Welcome back to Summit Times. We are in conversation with Dr. Sandeep Kashap. He is the liaison officer of Manipal and the advisor of Garib Jhan Kalyan Prakosta. So, welcome to Summit Times.
Hi, thank you.
So, we've been hearing a lot these days that government employees will get reimbursement, but now we've been hearing that public will also get reimbursement. So, what do you have to say on that?
Yes. First and foremost, I would like to thank the Honorable Chief Minister for coming out with such an initiative once he had taken over the government. And I also would want to clarify here that since it's not now, but it's since 2019, like the government employees as well as the public, the non-regular employees are getting reimbursement, I would say reimbursement as well as cashless treatments in various government empaneled hospitals across the country. So in such a case, what happens is the government employees, they get reimbursed up to 5 lakhs if it's for a small ailment, and if it's for a bigger ailment, then it's up to 10 lakhs. And for the regular public who are non-employees, for them the reimbursement amount is up to 2 lakh, and even the cashless amount is up to 2 lakh. So we can just keep a cap of 2 lakh rupees.
Sir, Garib Jhan Kalyan Prakosta aims to do the best and serve the best for the people of Sikkim. Yes. So, with these kind of camps and health programs, so what does Garib Jhan Kalyan Prakosta aims to achieve through this?
Yeah, first and foremost, Garib Jhan Kalyan Prakosta was the organization was formed in the month of July 2019 with 6 executive members here. Since then, as of today's day, we are more than 30 people who have been attached to Garib Jhan Kalyan Prakosta. And of these, the last 4 years, I would say 4.5 years, what we have been doing is for the general public who we have been keeping coordinators in Siliguri, in Calcutta, in Delhi, like people who are referred from the state to those places. Some coordinator comes, picks them up, drops them to the location where we have a place to stay for all the ailing people there, and take them to the hospital, because there are so many people who are not aware and who can't go to the cities and get themselves treated. That is one. And the other thing what we do in the state is we organize health camps. As of today, we have organized mega health camps in 6 to 7 places in the past 2 years, 1 year I would say. And whenever the Honorable Chief Minister is doing the Janta Bhet Karyakram, we have our own stall wherein people like the Chief Minister will be meeting around 8 to 10,000 public. So among those 8 to 10,000, some 2,000, 3,000 would be wanting like some medical treatment or something. So the other public whom CM has to meet, he can give ample time to them, and we meet the people who needs treatment, and we assist them like where they need to go, how the treatment can be done, if referral is required, how we go about. And from the time of treatment till the time of from the time of leaving this place, taking them till discharge and getting them back home, we do. Recently, in past 2 months, we have helped more than 300 patients from Sikkim for gallbladder stone operation in Siliguri. And even in the state also, like the Chief Minister, under the guidance of Chief Minister in Central Referral Hospital, we have started organizing cholecystectomy camps, wherein every quarterly we do 100 cases, and the payment is done by the state government.
So the last question. So you have been, the guys of your team are doing the camps and the program in Janta Bhet Karyakram. Last day was in Dentam and today is in Rinchenpong. So can you just name 2 critical conditions that have shown up in this camp?
Yes, kidney transplant. Whoever, what has happened is people who require dialysis or who have been doing dialysis from past 1 year or recently started or past many years, and who are not so aged, we take them directly to the Chief Minister after verification of the document, and the CM says he'll sponsor for the entire kidney transplant. He himself says, why do you want to go ahead with dialysis for the entire life? Somebody might be just 20, somebody might be just 30, somebody might be just 40, somebody might be just 50, or say 55, 60. They'll have a long span if they continue with the dialysis. But if a kidney transplant is done and successful, then the entire life they'll be free from dialysis and all these hospital visits now and often.
So,
in continuation, the same with liver. In Sikkim, you see, we have a lot of liver cirrhosis cases, and even the younger people also, I would say in Dentam, day before yesterday, a 12-year boy with a chronic liver disease, liver failure, who requires transplant. We took the patient along with his father to the CM. So he himself directly rang up in BL Kapoor Hospital and advised the concerned out there that he'll be sending someone from here along with the patient and the patient's party and to get the treatment done immediately.
So lastly, what do you want to appeal to the people of Sikkim regarding Garib Jhan Kalyan Prakosta?
Yeah, appeal in the sense now the entire state, the entire people, they are aware of what Garib Jhan Kalyan Prakosta have been doing in the last 4 to 4.5 years. So even now, if there are people who can't afford, or there are people who don't know how to go about with the official procedure for referrals, all these things, they can always contact us. Feel free to contact us. And even we have a office, Garib Jhan Kalyan Prakosta head office is above Sokethang Hospital, Sokethang Hospital in Gangtok, and it's open all days, including Sundays and holidays, from 10 a.m. to 4 p.m. So they can always visit that office and get the necessary work done from there.
Thank you so much for your time, sir.